Hello, welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Today I have Lisa Caviness with AMOREM. Lisa, what is AMOREM? People know your face, but I'm going to let you talk a little bit more about it.
People know the face of AMOREM, the faces of AMOREM. AMOREM was formerly Caldwell Hospice and Palliative Care and Burke Hospice and Palliative Care. On May 1st, our two organizations integrated into one provider, and our new name is AMOREM. And the name is Latin for the act of love, which that's why we chose that, because that's really at the core of what we do.
And this is not a takeover, this is truly a blending of two like-minded hospice.
Absolutely. We are very like-minded in our missions and the philosophy of care, and in the changing healthcare environment, we looked at a lot of things and realized that we could do more together. And we have more quality, more compassion, more support to all our service area, which is, instead of 8 counties for Caldwell, now it's 12 counties for AMOREM.
And the map, when I saw it the other day, I was like, wow, that's a huge area. But Caldwell was already serving 8 counties.
Yeah, we're not adding any counties to what we collectively served already. And the Burke staff will still serve that area, and they have a patient care unit and a facility there in Valdez. They also have a thrift store, which we're excited about. And they will serve that, work in that area. We will work in the areas that we are here in Caldwell and surrounding counties, as well as the high country. But we have resources, combined resources to pull from together and support for each other and for our community.
And you are still nonprofit?
Absolutely. That has not changed.
So talk to me a little bit about the difference between nonprofit and for-profit. I know in Caldwell County we have grown to love and respect our hospice, and I guess a lot of folks think that all hospices are like what we have here in Caldwell County.
You're right, but that's really not the case, and the number of for-profit hospices is rising greatly. And I don't want to imply that the for-profit hospices don't care about their patients, but they operate under a different business model, and they have to show a profit, or that's their goal. We want to be good stewards, but when we have a profit, we pour that money back into the program, and because of that, we are able to provide a lot of enhanced services to our patients because we think it improves their quality of life. And that's things that we do that we don't get any reimbursement for. In a for-profit, they're not set up to do that. They try to keep the cost, as lean as possible, which is one reason they don't have. It's rare that a for-profit will have a patient care unit.
What are some of the services that Caldwell and maybe even Burke Hospice, as non-profit hospices, have provided that you don't get any reimbursement for?
Well, we have a special cardiac care program, which we've had that in the past, but we've just launched a newer version, an updated version. We're very excited about it, and I hope to have somebody come share about that soon. We have a lot of veterans programs. The virtual dementia tour, we had to suspend that during COVID, but hopefully, we'll get that going back soon. A lot of programs like that are the extra veterans honoring veterans. Just so many programs like that, the music by the bedside, things that improve quality of life.
For patients, clients of hospice, how is this going to change their service?
It won't. It will be seamless. Our goal that we're working so hard that it'll be a seamless transition for our patients and families. They'll still receive the same quality care they have. So those kind of things, we have a long history of quality care, and that's not changing. What is changing is our name, which will be AMOREM, or is AMOREM. We'll have a new logo with new colors, new signs, new collateral materials. Your brochures will be different. The scrub colors will be different, but the people in those scrubs and the care they provide, that's not changing at all.
Facilities, you're still going to have your beautiful patient care units.
Absolutely.
So it's really no
Yeah,
different.
the sign will be different.
Why did you make this change?
We did it to provide, we felt like that together we could provide more service to our service area and have a greater impact on our service area.
And I know when you announced the name, you sent out a news release and you talked a little bit about what the board structure will look like, because hospice is, I guess since the very beginning, Caldwell Hospice was governed by a board, and I'm going to assume it was the same thing, a board of volunteers.
Yes, it is.
And so you have a little bit different board structure. You've merged the boards. What does that look like?
Well, we have a combined board, but that would be an enormous board. There were some people that just had decided they would step down. On both boards, we determined this is how many we need, and there's a great representation from all the areas. We have representation from Burke, from Caldwell, and then the High Country as well.
So really, here in Caldwell County, we're not going to see any change. We're just going to see more.
Right.
And maybe what we may see here is more services, programs that Burke offers that maybe we don't offer here.
Absolutely.
As you merge.
It will grow together.
And that's very exciting. How do people make that referral to hospice?
It's very simple. You can just make a phone call. And you may not know exactly what you need, but call and find out. They will just call and say, I've got some questions about your services, about a referral. And they will transfer you to our referral center, and they are wonderful at explaining the services. And you can also go on our website and request information there. And there are some great little forms that ask just a few simple questions. Is this an issue? Is this an issue? And to help you determine whether palliative medicine would best meet your needs, or hospice care would best meet your needs. But if you don't want to do that, just call us and we will, talk you through it and help determine how we can help you.
And when people call, who answers? I mean, you have a person
We
answering.
have a person.
And when you go to the referral center, you're talking to people locally.
Absolutely.
So it's
not a big call center.
It's
somewhere.
not a big call center somewhere. You're talking to people right here. You're probably talking to your neighbors.
Absolutely.
So there's some comfort in that. Who can make a referral to hospice?
Anyone can make a referral. It can come from your physician or a caregiver, a family member. You can call yourself, a friend, your pastor. Anyone can make a referral.
And I know we've talked a lot about hospice care and when to receive hospice care. How early can you start receiving hospice care?
Well, Medicare requires that you have to have a medical diagnosis of 6 months or fewer if your disease follows the course that it's on right now. But that's a guideline because that can change. It can speed up, it can slow down. We've had patients for much longer than the 6 months, and we don't just, 6 months, we're not going to release you. We reevaluate each period. And if you still meet that criteria, then we continue to provide care.
And again, that care, it's the same philosophy with Burke Hospice as it is with Caldwell.
Absolutely.
So again, that's another way you're not seeing the change.
Right.
You are in the middle of this merger, and we were talking before we went on air about all the moving pieces that you're dealing with. What's next? You've got something coming up next that people be looking forward to.
Right. We revealed our name, which is AMOREM, on June 1st, and we will reveal our new brand or our new logo on July 1st. And our signage will change, our website will change, the scrubs that you see our clinical staff coming to visit in will change. So that's what we're working towards right now. Getting those initial big changes, and it's not going to be an overnight thing. On July 1st, everything is changed. Mm-hmm. It's a process, and we estimate it will take 12 to 18 months before we can really say, okay, we're through with that part. And so we're excited. We've prioritized the things that we felt like needed to be first, and we're just working down the line to get those things done. But the thing that is not a process. Patient care will stay the same. That's not going to be. We're not going to have part of the patient care. We're going to have all the patient care. And
we failed to mention there's a familiar name at the helm of AMOREM.
Yes, there is. Kathy Swanson will be our CEO of AMOREM, and she's been with Caldwell Hospice for over 30 years, 32 I think. So Kathy will be at the helm. We have a new organizational structure that's being ironed out now that incorporates leadership from Burke and Caldwell, and no positions are eliminated. Some positions have changed and been reorganized a little bit, but we've not lost people.
And I believe Mark Carpenter, who is board chairman of Caldwell Hospice, will be chairman of AMOREM. Is that right?
Yes.
Okay.
I believe so.
I'm looking down at a news release you provided. Yes. So he's going to serve in the same role for the board of directors. So that's two familiar faces and long time.
Yeah. Long tenure.
Long tenure there, and from Burke Hospice, Dr. Gregory Jones, who I imagine a lot of people know because he has worked in this area for a number of years.
Right, he's a great guy.
And a great doctor. So a lot of familiar faces.
Absolutely.
And really it's about expanding what you're able to do.
And it's still neighbors, taking care of neighbors is really what it is. Our neighborhood is just a little larger and encompasses more area right now.
And you're still going to be using volunteers?
Absolutely. We've got volunteer training going on this week, and so I know there'll be some coming up. So I always put a plug for volunteers.
So all of those things are still important. So I would encourage folks just to watch as AMOREM grows, but still know that it's the same folks there taking care of you.
And watch, follow us on social media, Facebook and Instagram, as we put updates there. And then our website will change. Our target is July 1. That will have new information.
But it's really just about a look and a feel as far as the community's concerned.
Right.
It's not really, the people are not changing. So I think that is a comforting piece.
It is.
It really is.
It's an exciting time.
It is. It's very exciting because I know that, there's always a fear we're a nonprofit that for-profit is going to come in and change the way business is done.
But that is not the case. We are still a not-for-profit, still community-owned, and it will be that way.
All right. Lisa, if somebody needs hospice services, is interested in volunteering, is interested in making donations, all the things that we always talk about, how can they get in touch with hospice?
They can call 828-754-0101, or they can go to our website, and right now it is caldwellhospice.org. And even after it changes to the new website, you can still go to Caldwell Hospice for a while, and it will take you to the new site. And there's contact information there as well.
So don't hesitate to go ahead and reach out to hospice
Please
or to
do.
AMOREM. We're going to have to practice that because it's been Caldwell Hospice for a very long time.
Yes, it has.
So we're all going to have to practice and learn that new. Lisa, thank you for being here today and for talking to us about AMOREM and how it's growing, how hospice is growing, but not necessarily changing.
Absolutely. That's a great way to put it.
So thank you for being here.
Absolutely.
And thank you for watching Caldwell County Today.